Hi, my name's Ashley, and this module is called Engagement. It's normal to feel a bit nervous about your first visit to the gynecologist. We want you to understand that there's no reason to feel this way. For our objectives, we want you to be able to name at least 3 ways to effectively engage with your doctor during your appointment and be confident in discussing any problems you may have, identify the type of actions you can take before, during, and after your doctor's visit, and understand that you're your best advocate, and that by preparing for your appointment, you'll be able to leave with the help you need. The first thing we're going to talk about is how to schedule an appointment. You can start by asking any family or friends for recommendations. Ask someone you trust for their opinion about their appointment or doctor. Did they feel like the doctor made them feel comfortable the whole time? Did they feel like they were listened to? You can even ask your pediatrician or general doctor to recommend a gynecologist for you. Now, some people may not feel comfortable in visiting a gynecologist that's a man, and that's totally fine. You can ask your family member, friend, or general practitioner if the doctor is going to be a woman or a man. You can also check the office website and get an idea of who the gynecologist is. You can add a face to his or her name. You can even look at the Google reviews and see what other people thought about the office or doctor. Once you have chosen the office, you can call and ask any question you may have. Don't be afraid to ask if they take in people who don't have insurance if that is the case for you. Make sure to wait to ask any personal medical questions until your visit. Sometimes the person you're talking to may not know the answer. You can also ask what the first visit will consist of. Sometimes the first appointment is a question-based consultation. This includes questions about how you feel, family medical history, and what concerns you have about your body. Other consultations may consist of physical exams. Another step you can take is to have questions prepared once you have chosen your appointment date. Now, make sure these questions relate to you and how you feel. What to bring to your appointment? First of all, think very well before your appointment. What is the reason of your visit? What worries you about your body? What is concerning you? Write down these questions you have and be sure to bring them to your appointment. You can bring a notebook or take notes in the notes section of your cell phone. However, our app facilitates this step as well. When you open our mobile app, you can click on My Reproductive Plan and start a note there. This way, you can have all your notes and questions in one spot. The next thing you can do is write any previous doctors you have seen. Sometimes our gynecologist will want to know who our general practitioner is to get any medical history about us. After, you can write down any medications you are taking and the dosages. If you want, you can take a picture of each medication instead of bringing them all with you or writing them down. Lastly, write down any family medical history you know of. This will allow the gynecologist to be able to suggest any future exams or precautions you can take. Next, we will talk about what to expect at your first health visit. The American College of Obstetricians and Gynecologists, ACOG, recommends that your first gynecological visit be between the ages 13 and 15. This is usually the age when women begin to have their first period. The doctor will usually ask parents to wait outside during the question-based area of your visit. Now, your parent may not want to leave the room. Before your appointment, talk to your guardian about stepping out. You can talk to your parent regarding about how you feel about them being inside the room and how you would feel more comfortable with them stepping out for a moment. The doctor may also perform an external genital exam, which involves inspection of the mons pubis, labia majora, and any groin areas for any abnormalities, lesions, or other findings. If at any time you want your guardian to be present, you can inform the doctor. Do whatever makes you feel comfortable during your consultation. Another exam you can expect is a speculum pelvic exam. However, this exam is only performed on women over the age of 21 or those suspected of having an infection. The speculum pelvic exam allows the doctor to see the vagina and cervix. The speculum is shaped like a duck bill. They may warm it up before inserting it to make you feel more comfortable. Another thing you can expect is your doctor to go over STDs, STIs, and how they are contracted and their symptoms. He or she can go over instructions for testing and treatment of these STDs. Teens 12 years of age and older can consent to STD testing without a parent or consent. In Alabama, many STD exams are free. Another review would be contraceptive services. Under Alabama law, there's a general parental consent requirement for youth under 14 years of age. But even after that age, you don't need parental consent. The best idea to keep in mind is that you're your best advocate. You get to know the most about your body and get the most out of your employment. You should be able to communicate any problems or concerns you have with your doctor. Don't be afraid to ask any questions. There are no dumb questions. You know your body best, and it is important to be able to communicate with your doctor. After your appointment, reflect and see what you feel. Did you feel like you were listened to or not? Do you feel like you want to change your gynecologist or see someone else? If you feel this way, that is totally okay. You can talk about this to another person, like your general practitioner or your parent, to see if you can see another gynecologist. Do whatever makes you feel comfortable and where you feel like you've gotten the most help. Thank you.